Hi everyone,
Hi.
welcome to episode 2 of our video log. It was supposed to be a weekly video log and we're on week 6 right now and we're on episode 2. But
We've been
here we
busy
are.
though.
It's been busy. Today we're doing Q&A. We've had lots of people asking a bunch of different questions over the few months of us getting ready to come here, so we're going to answer a few. Number 1, how often do you leave the ship? Pretty often.
Yeah, as often as we can actually. It ends up
Yeah.
realistically being 2 to 3 times a week.
Yeah, there's lots to do around here. It's kind of a beautiful coastline that we're on and lots of mountainous terrain. It's all kind of jungle. So yeah, we've been out trying local food and we've been to quite a few of the beaches. I've been surfing twice. Just today we went out for a hike in the national park that's pretty close by. Like, where Freetown is on a peninsula and pretty much the entire peninsula is a national park in the center. So it's all mountains, jungle, it's beautiful. So we did a hike there today. Yesterday we went to a chimpanzee sanctuary. So yeah, on the weekends we always try and get out as long as I'm not on call. And in the week we've been out for dinner and stuff like that a few times. So yeah, there's lots to do and we're very able to get off the ship. I am also a ship driver now, so I have access to the Land Cruiser fleet, which is awesome. I love them and I want one. Yeah, so we've had a lot of freedom to get out and enjoy the country, which has been great. How many staff living on the boat?
Crew, there's about 640 people on the boat.
Yeah,
On the ship.
that's the volunteers. So the crew of volunteers, and it includes everyone from the captain all the way down to the people in the hospital, the people working on deck, cooks, cleaners, caregivers for families that are on board. So yeah, there's also capacity for 120 kids in the academy. So
There's
yeah,
about 70 kids on board right now. Let's see, the youngest now is 6 months old all the way up to 18.
like 16, yeah,
Yeah.
or whatever.
Yeah.
So yeah, it's like a K-12 academy on here, which is great.
Which goes into our next question. Are there lots of kids on the ship for Goldie to play with? Yes.
Yeah.
I would say the biggest represented age that's here, I don't want to say that.
I would say most of the kids are maybe like 4 to 12, so they're
Yeah.
in like primary or middle school
Yeah.
age.
Yeah, there's a couple that are really little like Goldie, and we're about to start a nursery up this week with all of them, so I'm really excited for that. There's like a range of 8 to 10-year-olds. There's like a flock of them that will find Goldie no matter where she is.
Yeah.
And it's so nice to have that community and for her to just like interact with. Yeah.
It's great. Honestly, it's so good for her socially, I think. I mean, it's great for us socially too. We've been really enjoying ourselves, but yeah, the social environment for kids here is like amazing. So it's already got us talking about, what it would look like for us to come here long term for a year or two and have kids in school and stuff like that. So yeah, maybe a few years down the road. There's a few questions about like our shifts and our working hours. What are they like?
Kind of day in the life questions.
Yeah, so I think we're going to do like a day in the life video, so stay tuned for that. But my shifts are basically like 8 to 5, sometimes a bit longer. I have an hour lunch break, which is awesome because I always get to have like breakfast, lunch and dinner with my family, I'm loving it. We're getting like tons of family time here too, so it really is, even though I'm working as a volunteer full-time plus call, I'm still having like way more family time while I'm here on my paternity leave. Yeah, it's still feeling like a paternity leave, which is amazing.
What happens if someone falls overboard? Hopefully you're with another person, because you want one person to point at the person that's fallen in the water and keep their eye on them at all times, and then you want the second person to go run and call 911. When there's an emergency on the ship, just like in Canada, you call 911. And
that doesn't contact the Sierra Leonean authorities, just so you know. It just get 911, just dial straight to the reception here and they can activate the emergency teams from there.
Yeah, there's actually like...
And you say man overboard as well.
Yes.
Rory missed that.
Yes, you say man overboard.
A very important piece, but yeah,
you
shout
say
for
that?
help. Yeah, and I think that's in the shot too. So you got the lifesaver ring, They do a briefing on like marine security as soon as you come on the ship. Everyone's a member of crew has to, have some marine security training. So the most important thing is like sound the alarm, keep your eye on the person and point at them. Don't look away from them, because in the sea it's like very easy to lose someone and then they're gone forever. That said, we're in the port right now and we're docked. So if someone goes overboard, they're probably gonna hopefully be able to swim around and get back on without too much fuss. Although the waves can get pretty choppy here, actually. It can be, it's
I
not
still
like
wouldn't want to call it.
No, yeah, we're up high too. It's not like we're washed up on a nice tropical beach. You'd have a hard time climbing up onto the dock here.
Yeah.
Attention crew,
Okay. Is there a gym on the boat to exercise?
Yeah. It's great, actually. It's really nice. So we're on deck 10 right now. Deck 11, there's like a big children's play area right outside the academy and a pool, and like a little area with like a pull-up bar, and you can do like bodyweight stuff outdoors. And then on deck 2, way down in the guts of the ship, there is a huge gym. It's beautiful. It's got treadmills and bikes and weight rack and squat rack and bench press and everything, so it's really nice. I was really stoked to come here and be like, yeah, I'm going to work out every day, it's going to be awesome. And actually I haven't been working out every day because it's been really busy. There's like tons of other stuff to do. We've been doing some salsa dancing on Monday nights.
Yeah, they have classes too. They do like Pilates, and they do like HIIT workouts, like group fitness kind of thing too. So
yeah, so I haven't done any of that, but
the salsa's been a hit though. I really like salsa.
Salsa's been fun.
Yeah, it's good. So lots of opportunities to exercise and work out.
There's a basketball court, like basketball, pickleball. There's a table tennis table.
Yep.
There's a running group.
Oh yeah.
Rory's a part of it. She hasn't been yet, but she's like, yeah, I'm a part of the running group.
Anyways, just cut all of this out.
She's planning to go. I might cut this out. I might put it all in.
I did join it last week, so Wednesday will be my first time running if I get to.
So yeah, there's lots of ways to stay fit. What else do we have?
Do you make your own food, or is it provided? We're so blessed here. We get all our meals provided for us, so we all eat in a big dining room.
It's like a buffet, so there's always different international foods and stuff, but there's lots of things that we would be used to eating at home, as well as there's always some kind of African dish, which I've been enjoying a lot of those. Lots of fish, spicy curry type dishes, so really good food.
Yeah, there's also a crew galley, so you can make your own food if you want to. It's a fully equipped kitchen. You just have to bring your own ingredients. I've made bread in there so far, and I'll be making Goldie's first birthday cake in there, so I'm excited to play around a little bit. It's
not like some rinky-dink little Fisher-Price stove that you can use when you want either. It's like a fully equipped like commercial kitchen that you can cook up a bunch of stuff in. Some of the dads went out on a fishing trip. They chartered a boat and came back with like 10 or 15 huge barracuda. So there was like a bunch of dads in the crew galley one day running all the ovens, like cooking these huge fish to feed people. And so we're very well taken care of food-wise.
There's also a cafe as well where you can get specialty coffee, drinks, and that kind of thing made as well.
Lattes,
so there's that, and the in-between meal times, which is really nice as well. So.
Yeah. I don't know if anyone asked that, but people are probably curious about local food. So we have been out and had quite a lot of local food. Seafood is like the big thing here. There's lots of seafood. So we had some really good like barbecued seafood, barracuda, shrimp. Lobster here they've got lots of big, beautiful lobster. Kind of different from the lobster at home. Really, really good seafood. And a lot of like barbecue stuff. The African food, it tends to be either like meat on a stick type stuff or some kind of like stew curry type dish with a lot of rice. So lots of spice, really tasty. So we're very well taken care of on the food front. So how long are we here for?
We're here for 14 weeks, so about 3.5 months.
It's kind of unique because normally to come as a family you have to be in like a 1 or 2 year commitment for a more senior role. In this case they didn't have anyone filling the senior radiology tech role for the whole field service, so they were able to say, sure, like I said, basically I can come for 4 months sometime in this window, and they said sure, come this time and we'll make it work. So we're really lucky that we were able to come as a family, get a family cabin, even though we're not here long term. It was easier for us because we only have one child and she's not old enough to go into the academy yet. So if we were coming and we had a kid that was going to school, we would obviously need to be here for the whole academic year too. So
they're very mindful of school-age children not being too disruptive to their life. It's funny, like the perspective is so different in Canada. When we told people we were going for 3.5 months, it sounds like such a long time. But then once you come here and you meet all the other families that are here for at least a year or 2 years, it's like, oh yeah, we're not here for very long at all. But we're making the most of it.
We are making the most of it. So,
how's your experience of Mercy Ships change your perspective on healthcare back home?
Yes. Do you want to go first?
Yeah, sure, I can. I think that being here makes me really grateful for the healthcare that I have back home. It's really easy to criticize the Canadian healthcare system. It's not perfect. It has its flaws for sure. And, I've been frustrated with it myself, but coming here and seeing the patients that we do on the ship and seeing what little healthcare and resources they have out in their communities really puts things into perspective and makes me really, really grateful actually for the healthcare that we have in Canada and just how lucky we are to have it.
Yeah, it's honestly, there's like so much doom and gloom around healthcare in Canada. Like, I hear all the time, especially online, like our system's broken, it's failing people, all of this stuff. And it's like, yeah, it could do better. We can always do better, but like, we have one of the best healthcare systems in the world. We do, in terms of access, in terms of what we're able to do. Yeah, there's wait times. Yeah, there's, shortages of different staff and so on. But from a historical perspective and from a global perspective, like, it's still one of the absolute best healthcare systems that has ever existed ever. So we're very lucky. And you got to kind of check yourself on that a little bit sometimes to realize, we're lucky to have access to what we do have access to. It sucks to wait for 12 hours in the emergency to be seen, but at least there's ambulances, like at least there's an emergency department that you can get to. There's so many people living in Sierra Leone and in West Africa that there isn't anywhere they can go. There's no doctor that they will ever see in their life. Mm-hmm. So yeah.
And we'll share some of those stories on Instagram and whatever of some of the patients that are coming through, and they come here because they don't have any other option. There's nobody else that can help them in their country. And you see people coming in with ailments and problems that would have gotten taken care of years ago in Canada, right when the problem initially started. And
the other perspective changer for me on this is it's really nice to be working in a hospital that has like very specific focuses. We're able to have a big effect because we have like basically a list of conditions. These are the things that we're here to treat. These are the things that there's a big need for in this country. So the model of specializing in certain things and treating certain things with certain surgeries that we can do here means that we can have a really big impact for a specific population, which is great.
Yeah. And then I think there's only like one more question.
Yeah.
Who do your doctors and nurses consult with outside of your actual role? Do you want to do that one?
Yeah, we have quite a few like global partners who are physicians that come on board and do surgery here, but also like have a remote consulting type role. For the orthopedic kids, for example, like most of the surgeons, they come for 2 weeks, they do a bunch of surgery, then they go and they hand off to another surgeon, and then they go to and it's like cyclical. Their patients have a much longer follow-up than they're able to stay here for. So patients are on board and they're at home, they're still able to look at x-rays and consult remotely, which is really helpful. So there's a lot of that. The other side of it is fully land-based services that we're able to use. So for radiology, there's a company in Canada called MIC, and they're basically a group of radiologists that does reporting in Alberta for a bunch of different hospitals, but they also report a bunch of stuff for us for free, which is amazing because it's not cheap. It's a very, very specialized area of medicine, and they've no doubt provided many, many thousands of dollars worth of free services over the years. So it's really great that we have that relationship. They're also really available for us to coach us on, what we can do better here, how we can better serve our patients imaging wise. So yeah, it's been a really, really good relationship to build. A few people have asked about kind of like what we do with the local healthcare system, or is there like a more sustainable side to this? Like we don't just come in and do surgery and leave. And yes, there is a huge integration into the local healthcare system with training. So we have a program, education, training, and advocacy. And basically we have people on the ship whose full-time job is to train and bring people aboard for training. And that's surgeons, that's nurses, that's all kinds of different people. A, bringing them on board to come and help out with surgery and train them to do things. B, going to the local hospital and doing training sessions there for safe sterilization and nurse anesthesia and all different things. So teaching the World Health Organization's surgical safety checklist is a big one. So at the start of surgery in Canada, we basically go through like, this is the patient's name, date of birth, we're amputating the right leg, not the left leg, all of those things, right? So you have like a checklist to go through before you start surgery, which is really important. And that's like an easy step that we can basically teach here, build into the protocols here for surgery, and basically improve surgical outcomes by making surgery more safe. So lots of different training items like that are very transferable, very international, and things that we can train to help lift up the capacity of the healthcare system in Sierra Leone, so that when we leave, we're not just saying bye-bye, see you later, we're leaving a lasting impact. There's quite a few stories of like doctors who have been trained to do surgeries and do procedures that we do on board, and then are able to stay in their home country and make a lasting impact, whether it's dentist or eye surgery or cleft lip and palate repair. Lots of surgeries that are like relatively simple surgeries, things that you can bring someone on board for a field service and train them to do, and really lift up the surgical capacity in a nation that couldn't happen otherwise. Because that particular service doesn't exist in the country, no one's there to teach it, kind of thing. So yeah, the education, training and advocacy is a really big part of the model, and it's a growing part of the model of Mercy Ships. That's the side of it that doesn't get talked about as much, maybe because it doesn't have the glittery eyes and the big smiles in the pictures, but it is something that makes a really, really big lasting impact. So it's just a really cool organization to be a part of.
Yeah.
Very forward looking. Yeah, just leaves you feeling grateful. You
Yeah.
know? The patients are all very grateful for what we're able to do for them, and we're very grateful for the pleasure of being able to serve here. One other thing on the day in the life type questions is, what does a day for Rory look like? Because Rory's like a full-time caregiver for Goldie. Rory, what can you do in the day-to-day on board the ship as part of the community here?
There's something that Goldie and I really like doing is going down to the hospital and visiting. So they have different times that you can go down and visit, and that is my favorite part of nursing, is the holistic stuff that you get to do to like help patients feel good anyways. So it's nice to still be able to do those things even though I'm not wearing my nursing hat this time.
Yeah.
So going down there and just spending time with the kids, playing games, just sitting and talking with them. Like, you can paint their nails, and Goldie really enjoys too.
That's just one thing too. There's
And
so
that's-
much like
yeah.
other community stuff on board that
Yeah.
you've been involved in. So
Yeah.
don't worry, they're not sitting idle.
We're not
and,
sitting around. There's so much to
making
do.
the best of it.
Yeah.
Anyway, as you can probably see on the video, the sun is going down, so we will leave it there. Thanks so much for watching, and
Thank you so much. It was nice to actually finally get this update done.
yeah,
And
keep asking questions too, because
yeah.
we've got lots more stuff coming up.
Yeah.
We're going to do maybe like a day in the life type thing. I'll show more of the radiology side of things, and we'll do some stuff out in the country too. We've got lots of different things we're going to go out and do, so take you along with us, and thanks for coming this far.
Thanks so much. See you soon.
See ya.